You've seen a lot of patients. You've seen a lot of people heal. How would you describe the people that heal?
That's a great question, Chris, because I find that people who just listen to me, they've done maybe a little bit of research, but they come in and they just say, Dr. Healy, what do you want me to do?
Yeah.
And I tell them, okay, here, I'm going to write everything down that I want you to do. And granted, sometimes it's a process because I can't tell you to do 20 things the first visit because it can be overwhelming. So, okay, we're going to start with this. And then in 2 weeks, I'll see you, or 1 week, or depending. I mean, if I have a critical patient, then I put them on a daily program right away.
Mm-hmm.
If they just are not obstinate and they don't ask questions and they just do it, they do beautifully.
They follow the plan.
They follow the plan.
Yeah.
I always tell patients, I can't download my 10,000 hours in a visit or two. I can't tell you why, where, when, and how, every single thing I'm going to tell you to do. Just if you have questions, you can ask my staff. I have a phenomenal staff who is very well aware of a lot of things, so they're going to learn. That's why patients, when they come to see me, I tell them, you're going to be educated, informed by the time you leave here.
Mm-hmm.
And now some patients come to me, I'm doing raw diet, I'm juicing, I'm doing coffee enemas, Dr. Keneally. Well, I know that patient. It's simple. They just, here, we're going to do this, foundational tweaks and everything. And then they do the rest. Because what we do is we arm and inform our patients to take care of themselves.
Yeah. That's medicine at its best.
Yes.
I mean, it really is. Teaching people how to be well, partnering with them, and obviously putting together a plan and a program and giving them direction. Some people need everything. Some people just need a little reassurance.
A little tweaking, yeah. Some people need very little tune-up. And, I tell them, you're on the right track. We're just going to do tweak here and there. And people, the body is not so simple. we take for granted, you take for granted your mind and body and how well your body
when
works
you're healthy. Yeah.
when you're healthy. But when you look at the complexity and the magnificency and the brilliancy,
it's infinite.
It's infinite.
Yeah.
And so if we would teach people very early on that health is important and that's how you stay alive, and we esteem health. We don't just esteem education and sports, but we esteem health so we can have and learn education, and so we can have and do sports.
Yeah.
Because if you look at the NFL now, a very famous football player is suing the NFL because of brain injuries and his problems.
The average NFL player only lives to be 58.
Right.
They have one of the shortest life expectancies of any American.
Right. So now we're learning all this. So we all probably ought to stop and say, okay, maybe we need to reevaluate this sport and how it's played.
Yeah. Well, so on the flip side, what do you think the biggest challenges are for patients when you give them a protocol and send them home? What do you see happen that really you wish didn't happen?
Well, I think, first of all, unfortunately doctors are telling patients how to live their life. And not how to live their life, but telling them you need to do this treatment and that treatment. And unfortunately, that's okay. And I tell them, I'm going to support you in your chemotherapy because you're going to take these Ayurvedic herbs so you can do the chemo.
Mm-hmm.
And I think doctors scare patients to death. Because your immune system, when you're diagnosed with cancer, your immune system drops because of the fear.
The fear. I've said this. Thank you.
It has been, directed and implanted in them.
That's right. People often get worse just because of the diagnosis.
So I think patients need to say, okay, Dr. So-and-so, this is great information. I really want to think about this and how it's going to affect my body and really, how is this drug going to affect my body? I want to know the complete array of side effects so I can prepare myself to not have those side effects. How about that?
You can't put your head in the sand.
Okay? You cannot.
You can't just...
You've got to take charge. You've got to take responsibility. Luckily, we have the internet today. Mm-hmm. We have people like you. We are informing and educating people now on a regular basis. And I tell people, if 20 people are saying this, there may be just a little bit of truth to it.
And it's more than 20.
And it's more than 20.
But what's so important is to know what you're getting into.
Yes, you need
really
to know.
need to know and understand. And it's overwhelming because they're like, oh, now I got to learn all this new stuff. And I get that, but it's vital.
It's
right?
absolutely vital to the process for you to be alive.
Yeah.
And so if you need to do chemotherapy, what are the nutritional supplements that you should be taking so you don't get neuropathy, so your heart still functions, so you don't get chemo brain.
Right.
So the doctor is not preparing the patient. When a patient's going to have surgery, I have a whole pre-surgical protocol that they need to go on before they even have surgery.
Yeah.
2 weeks before.
Diet and supplements.
So they can prepare their body so that surgery, they're going to sail through.
Yeah. Well, a lot of oncologists tell their patients to go home and eat whatever they want.
Every oncologist tells patients to do that, unfortunately.
Yeah.
Now, we all know.
It's crazy. And even patients who know, quote, nothing, are like, this doesn't sound right.
Right. I mean, if the oncologist is saying that, you mean to tell me that diet has nothing to do when what rules your biochemistry, the Krebs cycle of energy, which is the fancy name for what you do with protein, fats, and carbs, it goes through the Krebs cycle of energy. The whole system is driven by what? Nutrients. So if you have a nutrient deficiency of one thing, it's not working. Just one thing.
Yeah, and
just take zinc away from you, you will not have a good immune system.
And there are 90 essential nutrients that the body has to have. You don't have to have them every day, but you need to get them pretty consistently.
Correct.
And I think compliance is a big problem because, in the conventional world, there is no really compliance from the patient required. They're maybe taking some pills, right? Oral chemo pills or something like that. But for the most part, they just show up for their treatments and then they go home.
That's correct.
And then, but in the natural and nutritional and holistic side, there's a lot required from a person, from a patient, right?
Well, we could take that two different ways, Chris.
Okay.
There's a lot required to do it the bad way, and there's a lot required to do it the right way.
Yeah.
Think about it.
Yes.
Okay?
Yes.
You're going to the grocery store. You're going to pick foods that nourish, strengthen, and heal you, or you're going to choose foods that are not going to do you any good.
Right.
Okay?
Just satisfy your cravings.
Yes. So we don't want to look at this as this is complicated and difficult and restrictive. Like I had a patient call me this week, and I said, I always ask my patients, how's the nutritional program going? Because they know what they need to eat.
Yeah.
And so he goes, well, Dr. Keeley, I just got tired of my restrictive diet. And I said, what? Look what you just said. I can think of 500 foods that you could eat today that could help you. It's all about choices. Mm-hmm. Your choices,
making good choices.
Choices determine the future.
Yeah.
So it is about that. And so if we, from early on, your mom only gave you miso soup and seaweed and vegetables and fruit, where would you be?
Right.
That's all that was available. Let's say there wasn't Oreo cookies, and let's just say there wasn't McDonald's, and let's just say there wasn't these available. That's all you would know.
Right.
And you wouldn't say, oh God, this is the worst diet in the world, because that's all you knew and that's all you learned how to.
I'd be fine with
You'd
it.
be fine.
Yeah.
Exactly. So we now have all these addictive foods available to mankind that are destroying our health. And we know that. There's been documentary after documentary showing how what you eat affects your health.
And tons of nutritional science.
Tons. And
it's thousands of studies over decades.
Right. And
Many
food
decades.
science is just exponentially growing. And the beautiful discovery we're seeing about all the foods on the planet, it's absolutely beautiful. And people say, well, it doesn't taste good. No, that is not true. If you go to the Natural Products Expo, they have, you're tasting all day long, and it is good food. And it tastes good.
Yeah.